Assalamu alaikum and welcome back to my channel. So today we are going to discuss an abnormal chest X-ray. Before I told you about a normal chest X-ray, how to view it and how to identify the structures that are present within a normal chest X-ray. Today we are going to do an abnormal one. So whenever you're looking at an abnormal chest X-ray, we all know that the major reason why we do chest X-rays is to look at any pathology that may be present within the lungs. But that should not always be the case. You should always view the other structures that the chest X-ray is showing. For example, your clavicles. The clavicles may have a fracture, clavicles may be absent, or the clavicles may be underdeveloped. You may also look at the ribs. The ribs may be fractured, the ribs may be straightened. You may also look at the intercostal spaces. The spaces may be widened, the spaces may be narrowed. You may also look at the heart. The heart may be increased in size, decreased in size. There may be left straightening of the left heart border. There may be different shapes of the heart depending upon the congenital heart diseases. You may also look at the diaphragm. The dome of the diaphragm may sometimes appear flat if the diaphragm is paralyzed. So see, so many pathologies you can identify just by looking or focusing on the other structures instead of just the lungs. But since lungs and the heart are the major pathologies for which we do the chest X-rays for, those are the first thing that we are going to focus on in our abnormal chest X-rays. And today our main focus would be the lungs. Before telling you about the pathology that is present within this chest X-ray, I would like to tell you one thing that is important, and that is the zones and the symmetry of the lungs. What is the symmetry of the lungs? Now, when you look at this chest X-ray, both the lungs appear mostly similar, right? You can see the bronchosvascular markings, you can see the lucency, there's no whiteness, extra whiteness or extra blackness. So long story short, both the lungs appear similar. This is known as the normal symmetry of the lungs. Now, for example, you encounter one mass in this area of the lung. Now you will look at both the sides and you would say that lung asymmetry has occurred. Now how would you identify, or how would you describe that lung asymmetry? For that, we will also have to see the zones of the lungs. You have three zones of the lungs: the upper zone, the middle zone, the lower zone. The pic explains it all. I don't have to explain it further. But if there is a mass in one of the upper zones, lung asymmetry has occurred. Now both the lungs, the upper zone on both sides is not similar. You would say that there is a mass in the upper zone or the upper lobe of the lung. Okay, there's a mass or a consolidation in the upper zone or the upper lobe of the lung. This is how you describe the lung asymmetry. And just like that, if there's a mass here or there's a mass here, that's how you will describe the asymmetry. Now the question arises, what if there's a mass on both sides? If there's a mass on both sides, then lung asymmetry has not occurred. The lung is again symmetrical. Then you will describe how much the mass is present, how big or small it is, how dense it is, the things like that, where you identify the mass like that. Then now there's one more thing that I would like to explain to you, is that the pathologies in the lungs, they occur in two ways. The pathologies may be in the form of increased whiteness, or the pathologies may be in the form of increased blackness. Now what is increased blackness? Increased whiteness you can identify. Okay, what is increased blackness is that if you look at this lung, you may appreciate that this area of the lung appears darker than the other lung, and even its own counterpart. How would you identify it? Sorry, I just cropped the image, sorry for that. So you may appreciate that this area of the lung appears more darker than its own structure and the other lung as well. Now this is known as the increased blackness. The rib shadows may be decreased, the bronchosvascular markings may be decreased, and sometimes the ribs completely disappear in this part of the lung. So this is known as the increased blackness. Whenever the increased blackness is present on the lung, we call it hyperlucent area. That is known as the hyperlucent area. Whenever there is increased whiteness present on the lung. Now increased whiteness is very easy to spot, ठीक है. So whenever there is an increased whiteness present on the lung, you call it hyper dense area. So this is hyperdense, and what we saw before was hyperlucent. Now since the chest X-ray today is showing in hyperdense area, and I would like to tell you that this chest X-ray is showing consolidation with air bronchogram. Now how to identify that? How did I tell you, I just threw it on your face कि ये जो है consolidation है with air bronchogram. So consolidation appears whenever your alveoli or your small bronchi, they become filled with fluid. Now the fluid जो है today we are focusing on consolidation, and consolidation is whenever your alveoli or your small bronchi become filled with fluid. Okay, but it may not be fluid every time, and that is what I would like to tell you. This consolidation always, first of all, ये जो consolidation होती है, it always appears, consolidation always appears white. ठीक है, whether it's a consolidation, whether it's a mass, whether it's fibrosis, whether it's a cavitation, it will always appear white. Then what can this consolidation be if it's not fluid every time, or if it's not due to infection every time? This consolidation may be pus, as may occur in pneumonia. It may be fluid, as may appear in pulmonary edema. It may be blood even, as may occur in your pulmonary hemorrhage, or it may be a mass of cells. It may be a mass of cells, as may occur in cancer. So see, it is not only the consolidation is not always due to infection, and it is not always fluid. It may be pus, fluid, mass, or blood. Now how to identify this consolidation? Now you look at this area, your small alveoli. This lung contains alveoli all the time. Every time when you look at the lung contains the alveoli. Now the alveoli turn white. Here you can see. Sometimes the consolidation, the rest of the lung appears clear, just like this part of the lung, the lung appears clear, and consolidation may be present like this. I have seen consolidation like this too, okay, white spots in the whole lung, but the lung appears clear, not like the lung that you are seeing here. So, okay, the consolidation may appear like this. Okay, I've seen consolidation like this too, but that's not the case every time. Just like you can see here, the consolidation is present here, 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 here too, here, here. This is all consolidation, okay? All of this is consolidation. The lung appears hazy because maybe some kind of infective process is going on. Whenever an infective process is going on, the lung appears hazy. Or there may be pleural effusion as well. Now how do you differentiate pleural effusion from the normal haziness of the infective process? Is that you look at the costophrenic angles. Look at the costophrenic angles. If the costophrenic angles appear clear, if you can appreciate the costophrenic angles, that means the pleural effusion has not occurred, because whenever a pleural effusion occurs, costophrenic it always settles down in this area due to gravity, and these angles become blurred, these angles become obliterated. You won't be able to appreciate these angles at all. Even in this picture you can see that the angles are not that satisfactorily appreciable, but at least you can see this corner, right? You can view this corner in pleural. In the whenever pleural effusion is present on chest X-ray, you won't be able to view this corner at all. That is your pleural effusion. Now moving back to our consolidation. So you identify the consolidation. Okay? Now after identifying the consolidation, there's one thing that you have to, one other sign on chest X-ray that you always have to identify, and that is the air bronchogram. Now air bronchogram is always present with consolidation if the consolidation, the fluid, the pus, the blood or the mass of cells has not involved the larger bronchi. It has only involved the smaller bronchi and the alveoli, but not the larger bronchi. And how would you appreciate the air bronchograms is that when you will see in this chest X-ray, see all the X-ray is white, right? All the X-ray is white, but when you actually focus, you will see some area that is not white. Here, 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 here to this area. You can actually appreciate that this tubular, there's some tubular structures that have not turned white. Now you can focus on them more clearly. I've removed the red lines, focus on them more clearly. This area, see a tubular structure not turned white, tubular structure not turned white. These are the air bronchograms. These are actually your larger bronchi that have not been involved by the consolidation. So air bronchograms are mostly present in the X-rays that are showing you consolidation. So today we did consolidation with air bronchogram chest X-ray. This was a video on the abnormal chest X-ray, and I also told you the DDs or the differential diagnosis of the consolidation. Whenever someone asks you the differential diagnosis of consolidation, now you know it's consolidation always occurs when your alveoli or the small bronchi become filled with something, and the differential diagnosis of that consolidation will be pneumonia, pulmonary hemorrhage, pulmonary edema or cancer. So this was all for today. Thank you and Allah Hafiz.